Patients are often scared, frustrated, or even confused when they walk into your office. And a little empathy can go a long way. It can make a huge difference. You're not just a doctor. You're guiding them to help them make those informed decisions about their healthcare. So remember, when you connect with your patients on a personal level, not only enhances their care, but strengthens your practice. What if the secret to skyrocketing your practice's success isn't about fancy equipment or cutting-edge treatments, but how you communicate to your patients? As an orthopedic surgeon who's seen firsthand how the medical system can weigh down doctors and patients alike, I know how important it is to build a strong, trusting relationship with your patients. I'm Dr. Ariana Demers, the queen of Orthobiologics, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. It's not just about offering the best treatments, but about how you communicate with your patients every step of the way. Today, I want to share some key insights into what makes a good doctor-patient relationship. Let's get started. So, what makes a good doctor-patient relationship? At the heart of successful communication lies one thing. You've got to be clear about it. I can't stress how essential this is to talk openly with your patients about their diagnosis, about their treatment options, and yes, the costs. We've been taught that we shouldn't talk about money, but we really have to be clear and transparent. Your patients are trusting you with their health, and they need to feel informed and empowered to make those decisions. Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally, if you're ready to start this journey with me in my Orthobiologics Masterclass, come join us. This is where cash-based services like orthobiologics, like PRP, bone marrow concentrate, can really shine. By offering these services, you take away the confusion and the hidden fees that usually come with insurance-based practices. And so this fosters that doctor-patient relationship with transparency. With PRP, your patients know exactly what they're getting, what it costs, and how it can benefit them, because you talked clearly each step of the way. Imagine if you're sitting down with a patient who's been struggling with chronic joint pain and maybe even considering surgery. That's why they're coming to you, because they've given it up and they're thinking, gosh, I guess, surgery is just the next step. By offering them PRP as an option, you can clearly explain the benefits, how it helps naturally to heal tissue, reduce pain, all the while avoiding the risks and downtime of surgery. With this transparency, this builds trust and ensures that your patients feel supported and involved in their care. You're not just a doctor. You're guiding them to help them make those informed decisions about their healthcare. So there's a lot of talk about empathy. And I want to talk about why empathy matters, like real empathy matters for your patients. Empathy is the glue that holds patient care together. When you take time to understand what your patients are going through, both physically and emotionally, like really understand, and delve into the deep whys, you can provide care that goes beyond fixing that superficial problem of why you have them sitting in your office in the first place. So patients are often scared, frustrated, or even confused when they walk into your office. And a little empathy can go a long way. It can make a huge difference. So, you try to think about a patient who's been hesitant to try PRP. Maybe they've been told they need surgery but don't want to go down that road. By showing empathy, listening to their concerns, acknowledging their fears, and maybe they don't even tell you those fears. Maybe they're really scared about general anesthetic, or maybe they're really scared about losing control. You can help them feel heard and respected. And so practical ways to show empathy, and these are pretty straightforward, is validating their feelings during your consultations. Saying, your feeling is not wrong. and here's why. Or following up after treatment to check on their progress. And of course, there's a balance to strike. As doctors, we're professionals, and, we have a duty to maintain boundaries, but it is possible to be compassionate and professional at the same time. You can still show empathy while making sure that your patients know that they're in good hands, that you're a professional. This is what you do. So PRP, for example, is a non-invasive, effective option for many patients. And understanding their journey from their initial skepticism to their post-treatment relief is a key part of the process. Clear communication is imperative in delivering true healthcare. Active listening is a cornerstone in effective communication. It's not just about hearing the words that your patients are saying, but truly understanding their needs and concerns, whether they voice them or not. So take a moment to ask the right questions, to listen intently, and give them the space to express themselves. Don't have your hand on the doorknob walking out the door, getting ready to craft your message or what you think their problem and solution are. Truly breathe, take time, and listen intently to your patient to understand them, their fears, and why they're there. This shows your patients that you value them for them, and it helps you to understand what your patient is really going through. Then there's a way that you can explain the treatment options that resonates with them. We all know that one of our jobs is to distill the complexity of medicine, and patients don't often understand these technical terms. So part of our job is to translate those complex terms into understandable terms without losing the important pieces of it. This is that art of simplification, whether it's explaining PRP or any other treatment in simple, relatable terms really helps patients to not only not feel like they're being talked down to, but helps them feel confident in their decision making. So for an example, instead of diving into the technical jargon, you could say, PRP is like giving your body's healing process a boost. Or one of the ones I like to use is PRP is a megaphone of signaling for the cells to tell them what to do. And you can say, we're using your own blood and your own growth factors to accelerate tissue repair and reduce inflammation by using that megaphone, i.e. the growth factors, to talk to the cells and tell them what to do. And when patients understand what's happening, they are absolutely more likely to follow through with the things that we've asked them to do. And then finally, really, it's not a one-size-fits-all. I think tailoring your approach for each patient's unique preference and where they're coming from is going to be important. Some patients prefer a more straightforward explanation of what it is that we're talking about, what they're doing, the why behind it. And then others may just need reassurance, and still others may need a step-by-step, like very detailed. One of the ways that I try to tailor my discussion is in their intake form. I always ask them what their profession was. If they write retired, I said, well, what did you used to do when you were working? And that gives me a good idea of how they interact with the world. Are they an engineer who needs to have everything kind of laid out? Are they HR? They're used to dealing with lots of people. So really to tailor that to how they interact with the world. And then adjust your approach to meet them where they are, and you'll definitely foster a much deeper connection. Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally, if you're ready to start this journey with me in my Orthobiologics Masterclass, come join us. So I had a patient who has pretty significant hip arthritis, and he has seen another orthopedic surgeon or two, and he has been told that he needs a hip replacement. And he has not scheduled a hip replacement. Now, he came to see me, and we started to dive into the fact that he had not scheduled the hip replacement when it had been recommended. And I dove a little deeper into the why. I said, I know you've been recommended to have a hip replacement. You do have hip arthritis. Now, number one, tell me a little bit more about why you're here to come see me, knowing that, I do hip replacements, but what we're recommending and why you filled out the questionnaire is for injection-based care. And number two, why it is that when you've been recommended to have a surgery, you haven't gone through with it. And so what he shared was really, really important. And he shared that he is the primary caregiver for his wife, who is homebound and not able to have care anywhere else. She has a medical condition that he has been uniquely trained to care for her and doesn't have support outside the home. So having a surgery where he stays overnight or even is incapacitated is not going to work. And so when I dive deeper with him and say, okay, well, what we can do for you from an injection standpoint is probably not going to solve your problem, as you have advanced hip arthritis, and an injection-based therapy is not going to solve the problem. He says, yes, I understand, but my goal is just to be able to push her wheelchair comfortably. Said, okay, so you understand that this is not necessarily a cure-all. He said, absolutely. I'm not looking for that at this time. I'm looking for more time with my wife, doing a great job caring for her. Can you help me? And my answer is, of course. But if without understanding the why behind why he's seeking treatment, why he hasn't followed through, and what I can do for him, and that maybe I do have a limited range of success, but can I improve his current status with PRP therapies, then we couldn't ever have that deeper conversation. And so, of course, we were able to give him a PRP injection in his hip and significantly improve his symptoms so that he could push his wife in her wheelchair, so that he can provide care for his wife. And this has been a game changer for him. But without asking the hard questions, we just don't know how to care for our patients appropriately, with transparency, with empathy, and really do a good job. Sometimes when I am talking with students in my class, and they're like, yeah, well, of course, this is what you do. You're really good about talking to your patients about these things. You have the confidence, but I just don't feel comfortable. I just don't feel confident. And what I'll tell you is, it doesn't always happen that way. And you just have to keep going. And I would like to share a little story about maybe some of my less than stellar experiences about how I talk to my patients about these cash-based procedures. So I had a patient who came to see me for a consultation for severe knee arthritis, not too severe that she needed surgery, but could be within the realm of surgery. And so when we talked about her diagnosis, she has knee arthritis, she has some bone marrow lesions, and I started to talk to her about what I would offer her. And I made some judgments or assumptions on what she could or could not afford. And I told her that we could most likely give her a PRP injection, maybe some shockwave, and give her 12 to 18 months of relief. And she kind of shut down and told me, okay, well, is that all you have? And I was like, well, we could do surgery. She's like, well, I didn't come to you for surgery. And so this becomes this really negative experience for both the patient and the doctor. I'm sitting here thinking, well, she doesn't want my services. And she's sitting there thinking, well, she's not going to help me. And then I said, well, there is bone marrow concentrate. And if all things were free, I would recommend bone marrow concentrate, intraosseous treatment, bilateral knees, and we could get that done. Here's the price. It's definitely a higher price point than the PRP. And she was like, well, can I have a general anesthetic with that? And I said, well, no, like that's not usually done. And she was like, okay, well, I'll think about it. And she went away and she thought about it. And then we did a follow-up, and she scheduled another follow-up appointment. Her husband came with her. And I really screwed up because I didn't ask her what her goals were. I didn't ask her what her fears were. And turns out she is terrified of needles. And it also turns out that she has unlimited funds. And so I could, and I did, construct a way to get her treated that got all of those things taken care of. But I didn't do a good job at asking her what the hangups were with surgery, what the hangups were with injections. I didn't ask those hard questions. And so I nearly didn't even get the chance to provide a treatment that she was looking for, wanted to go forward with, because I didn't ask those hard questions. By luck, she came back and gave me a second chance to prove that I can have empathy and I can suspend judgment and not look at the outer covering of what people look like. And I can suspend that judgment of what I think is in their wallet and offer them what I think is the best option, and then go through why that may or may not work with the patient. So ultimately, we scheduled bilateral knee, intraosseous injection, bone marrow concentrate under general anesthetic for her. And she's now in her recovery phase and is very happy and feels heard and is happy to do all of the things I've asked of her, because I was able to deliver the thing that she was hoping but could not articulate I was going to deliver for her. A strong doctor-patient relationship is built on clear communication, empathy, and transparency. Offering cash-based services like PRP fosters trust by eliminating confusion around costs and treatment options, empowering the patient to make an informed decision and understand exactly what we're doing. By actively listening, simplifying complex concepts and terms, and showing empathy, you create a supportive environment where patients feel heard and valued. So remember, when you connect with your patients on a personal level, not only enhances their care, but strengthens your practice. If you're ready to take your practice to the next level with cash-based services like PRP, don't forget to subscribe to my newsletter for exclusive tips, strategies, and updates. You'll get insider information directly to your inbox to help you grow your practice and provide the best possible care for your patients. If you found this video helpful and you want to take a deeper dive into building stronger doctor-patient relationships, please make sure and hit the subscribe button. I'll see you in the next video.